Hello, and thank you for joining. Welcome to the Preschool Environmental Experiences and Development Study Parent Webinar. This study is funded by an Environmental Protection Agency grant and is being conducted with RTI International, a nonprofit research institute, and North Carolina Central University. My name is Jennifer Hopenick-Redmond, and together with my colleague, Dr. Michael Willoughby, and our overall study team, we're ready to share study updates with you and listen to your questions and feedback. Specifically, we will discuss the purpose of the study, the results of the environmental samples that were collected from your home, and what your sample results mean. And now I will pass it over to my colleague, Anna Gold.
Thanks, Jenny. My name is Anna Gold, and I am one of the recruitment coordinators for the PED study. Children are exposed to many common contaminants in their day-to-day life. Because their brains and bodies are growing so rapidly, young children are particularly sensitive to environmental exposures. Our team is working to understand how children's everyday surroundings might impact their early development so that families, childcare providers, and early educators can take action to help raise healthy, thriving children. To look for chemical contaminants in your children's everyday environments, we ask for your help to collect water and dust samples from your homes and saliva and hair samples from your child. We also requested that your child wear a silicone wristband for 1 week. In the samples that you sent us, we looked for lead, other metals, including aluminum, barium, copper, selenium, and others, forever chemicals, also called PFAS, or per and polyfluoroalkyl substances, and cotinine, an indicator for exposure to tobacco. These are all commonly used chemicals that children may be exposed to in their everyday environments that may influence their cognitive development. We'll begin by discussing potential sources of lead exposure. Lead-based paint was primarily used in buildings before 1978 in interiors, exteriors, door frames, stairs, railings, windows, and windowsills. Soil around older homes that used leaded paint and dust along the side of older roads can still have high levels of lead in it. Lead was also used in water infrastructure because it doesn't rust and is easy to manipulate, so it was included in piping, plumbing, fixtures, and even the solder connecting pipes. Efforts have been made to place restrictions on using lead in manufactured products, but lead can still be found in dust, water, and soil. There is no safe level of lead exposure, and health effects from lead exposure are irreversible, lifelong, and cumulative as exposure continues. These may include issues with hearing, speech, the brain and central nervous system, growth, and development. Learning and behavioral issues include lower IQ, decreased ability to pay attention, and underperformance in school. We tested both your floor and windowsills to look for different sources, traffic, and cleaning patterns that may cause dust to accumulate in one location over another. Floor dust can come from sources inside your home as well as material tracked in from outside. If your home was built prior to 1979, it may contain lead-based paint. Windowsills often gather dust that includes old paint from the interior or exterior of the home. Lead in soil could also be a source of lead in your household dust, especially if you have pets or wear shoes inside. The Environmental Protection Agency and Department of Housing and Urban Development's lead hazard standard is 10 micrograms per square foot for home floor dust and 100 micrograms per square foot for home windowsill dust. If your lead dust levels exceed these lead hazard standards, we recommend taking action to reduce exposure to lead and dust. It is important to maintain all painted surfaces in good condition and clean surfaces frequently using a wet mop, cloth, or sponge. You should also use a lead-safe certified renovator to perform any renovation, repair, and painting jobs to reduce the likelihood of contaminating your home with lead dust. We also analyzed your dust samples for other metals, including aluminum, antimony, arsenic, barium, beryllium, boron, cadmium, chromium, copper, iron, manganese, nickel, selenium, thallium, and zinc. Metals in floor and windowsill dust can come from sources inside your home, such as cleaning products, cooking emissions, cigarette smoking, or paint, as well as material tracked in from outside. There are currently no established hazard guidelines for metals besides lead and dust, but exposure to metals and dust can potentially lead to health effects. To reduce exposure to metals and dust, we recommend maintaining all painted surfaces in good condition and cleaning frequently using a wet mop, cloth, or sponge. Removing shoes when entering the home can also reduce the metals and other contaminants brought into the home. To discuss lead exposure in water, lead levels are measured in parts per billion. The North Carolina state action level is 10 parts per billion. To help visualize 10 parts per billion, that is the equivalent of 1 penny compared to $1 million. Because there is no safe level of lead in drinking water, we have simple actions you can take to reduce your risk of exposure at any level. If your water had a lead detection level of less than 0.1 parts per billion, we recommend some no-cost cleaning water habits as an easy way to reduce or eliminate exposure to lead in drinking water. These include designating which taps are for drinking and cooking, using only cold water for drinking and cooking, and removing and rinsing loose debris from faucet strainers and aerators regularly. If your water had a lead level at or below 10 parts per billion, we recommend some low-cost risk mitigation measures to minimize exposure to lead. These include installing and maintaining a lead-certified filter, replacing faucet fixtures, fixing clogs, letting cold water run for 1 to 5 minutes prior to use for drinking or cooking after periods of inactivity, and using lead-free products for drinking and eating. If your water had a lead level at or above 10 parts per billion, we strongly recommend you use those low-cost clean water habits, as well as immediately stopping use of this tap for drinking or cooking. Provide alternate drinking water sources and check to see if you have a lead service line. You can scan the QR code on the screen or click the link in the chat for instructions on how to check for a lead service line. The same metals that were analyzed in your dust samples were analyzed in your water samples. Metals in your water could come from the source waters, the water treatment process, distribution piping and water storage tanks, and/or household plumbing fixtures. Your results were provided with some health-based guideline levels set by the U.S. Environmental Protection Agency and World Health Organization. We also shared resources to help you understand the potential sources and health effects for each metal. If your water has high levels of metals, we recommend installing and maintaining a certified faucet filter. The next contaminant we looked for are PFAS. Per and polyfluoroalkyl substances, also known as forever chemicals, are human-made compounds that do not easily break down in the environment or human body. PFAS are used to make products water repellent or stain repellent. PFAS are commonly found in nonstick cookware, carpets and furniture upholstery, rain jackets, and firefighting foam. Drinking water contaminated with high levels of some types of PFAS could increase the risk for developing cancer, thyroid disease, high cholesterol, high blood pressure, and a reduced immune response to vaccines, as well as impacting early brain development. If your PFAS levels were under 10 parts per trillion, the total PFAS content is not exceeding state health limits, but action is still recommended to reduce PFAS levels in your water. If your PFAS levels were between 10 and 500 parts per trillion, the total PFAS content is above bottled water standards for PFAS, but less than the maximum amount in drinking water in the European Union. We recommend taking precautionary action for taps in this range. If your PFAS levels were above the 500 parts per trillion, the total PFAS content is higher than allowed in drinking water in the European Union, and we strongly recommend taking precautionary action. If PFAS are found in your water, there are common water filters that do a good job of removing them. If the total PFAS concentration in your water is 200 parts per trillion or less, we recommend using an under-the-sink activated carbon block filter. These types of filters have been shown to work well for removing PFAS from private well water and treated tap water in real-world tests. They've also been shown to be effective at levels above 200 parts per trillion of total PFAS during lab tests, but they've not been tested as extensively for well water at higher levels. If the sum of all PFAS in your water is above 200 parts per trillion, we recommend using a reverse osmosis filter. Reverse osmosis filters have been tested in the lab and have been shown to successfully remove up to 5,600 parts per trillion of total PFAS. These are some examples of filters that you can use. The best choice for you will depend on your particular situation. You can find more information about PFAS filters in your results report. The same metals that were analyzed in your dust and water samples were analyzed in your child's hair sample. Exposure to metals can happen through water, dust, soil, and other potential sources. To reduce the chance of metals exposure, we recommend following the previously mentioned guidance for eliminating metals exposure through dust and water, including cleaning frequently and installing and maintaining water filters. The next contaminant we looked for is cotinine. Cotinine is a product formed when nicotine enters the body. Cotinine analysis is used to determine exposure to nicotine through environmental tobacco smoke or secondhand smoke. Growing evidence suggests that exposure to cigarette smoke is associated with cognitive and behavioral issues, attention problems associated with ADHD, and other health impacts such as ear infections, asthma, bronchitis, and pneumonia. Your child's saliva sample was analyzed for cotinine to determine tobacco exposure. The detection level of cotinine is 1 nanogram per milliliter. If cotinine levels are below 1 nanogram per milliliter, it was not detectable. To protect your family from exposure to tobacco, do not smoke or let anyone smoke inside your home or vehicle. Smoke from one cigarette can stay in a room for hours, and opening windows and using fans, air conditioners, air purifiers, air fresheners, and ventilation systems does not get rid of secondhand smoke. Secondhand smoke can spread through your home by traveling through doorways, cracks in walls, electrical lines, ventilation systems, and plumbing. Prohibiting all tobacco use in the home will minimize any exposure to secondhand smoke. The last sample that was collected was the wristband that your child was asked to wear for 1 week. This was used to look for PBDEs, or flame retardants, in their everyday environments. If you did send back a wristband, the PBDE analysis results will be provided in a separate report at the end of the study, which will be at the end of 2025. Once we have completed data collection, we will examine the impact of environmental exposures on children's early cognitive development using the data we collected from you through interviews and surveys, as well as the information we gathered while playing computer games with your child at their childcare center. Our goal is to provide actionable findings that help North Carolina children learn, grow, and thrive, both at home and at school. We will use the results to improve environmental health literacy in North Carolina, considering the ways in which our study results can be translated to support prevention and early intervention activities, which include chemical exposure prevention and efforts to strengthen families. Thank you so much for your participation in the PED study and for taking steps to help protect children from environmental hazards. We will now have a live question and answer session. If you have any questions that aren't answered today, please visit the contact page on our website or call or text us at 855-997-0089, and a member of our team will be happy to assist you. Please feel free to put any questions in the Q&A box or raise your hand and we will unmute you to ask a live question.